Good morning. This is the AFP open enrollment meeting for the folks that are outside of the area of Virginia. We're going to talk about your annual open enrollment and with a renewal effective date of 12/1. My name is Nancy Grasso and I'm with Digital Benefit Advisors. My role in the organization as a consultant, and I work with the leadership team to help create and modify the benefit packages. In front of you, you should have a couple of items. One is a benefit guide, and so that will be your 12/1/2015 through 11/30/2016 benefit guide. It'll show all the plan designs that we're talking about today. It's in a little packet so that you can, like a folder booklet, so that you can keep it with you to refer back to it throughout the year. In addition to that, you have a Guardian booklet that shows all of the Guardian benefits that are being offered to you today. There's also a rate sheet and an enrollment guide and an enrollment form. So make sure that you hang on to the enrollment form because you will be required to turn that in. Today we're going to talk a little bit about open enrollment, what it is and what it's not, help you understand what your benefit options are and how they've changed, talk about what we at Digital Benefit Advisors can do for you and how we can help you throughout the year, and then the logistics on what you need to do after this webinar to get your paperwork submitted. So open enrollment is an annual time of year when you can actually make changes to your health plan. You're able to look at the multiple options that are offered to you, understand them, and make a selection on which plan is best for you and your family. You have an opportunity to add dependents onto your plan or take dependents off. If you haven't been on the plan before, this is your time to get on. Or if you choose to go on to a spouse's plan, this would be your time to get off. You can actually make changes to your plan now, but once you make a decision on what plan you want and what type of coverage you want and who you want to insure, you can't make a change throughout the year until next year's open enrollment. However, if your family goes through what we call a qualifying event, which is usually a family status change, then you can actually make changes. Some of those are marriage, death, divorce, birth of a child. One of the things that actually opens up your enrollment that most people don't know is that if your spouse goes through open enrollment at another time, so say today you have open enrollment and in March your spouse's plan goes through open enrollment at his or her job. Once that plan starts to go through open enrollment, it automatically allows you to make changes to your plan. So if at this point you're not sure if you should add your dependents or take them off because you're not really sure what's going to happen with your spouse's plan, you can certainly wait until you have a better understanding of what's going to happen to your spouse's plan and then change at that time. In other words, you're not going to be able to make any changes until next open enrollment. So we are renewing with Anthem and we are keeping the same plan designs. The new policy year is 12/1. So if you make changes to your plan or you switch what plan you're on, all those changes will go into effect on 12/1. A couple things that you need to know is all the plan designs that you have available to you today have a function of deductibles, co-payments, a co-insurance feature, and a max out-of-pocket. A deductible is basically the amount of money that you have to spend as an employee, as a person insured, on your plan before the insurance company decides that they're going to pay. And that's a flat amount that goes from that is a calendar year aggregator. A copay is a little bit different because that's a flat fee and that's paid instantly at the time of service, and those will kind of keep going. They don't really max out where your deductible will max out at a certain number. Coinsurance is represented usually in a percentage. So what literally will happen is once you meet your deductible, there are some areas where you'll pay coinsurance. And depending on the plan, that could be 80/20, 70/30, 50/50 in some cases, and so the coinsurance is the lower amount is generally yours. So if it's a 70/30 plan, the insurance company will pay 70, you'll pay 30, and then you'll have a max out of pocket. So some people will say to me, well, how can I possibly afford a plan that has a 30% coinsurance? Because if I have a big gigantic bill of $1 million, I certainly couldn't pay 30% of that. And so just know that every plan has a maximum out-of-pocket. And that maximum out-of-pocket is really what drives the rates on the plan. The maximum out-of-pocket will be the most amount of money that you as an employee or a family will pay before the insurance company kicks in at 100%. And so keep that in mind when you're looking at your plan designs and the selections that you make this year, because that should weigh in pretty heavily. All the plans that we're going to talk about today have a preventive care benefit. So that means that all things preventive are covered at 100%. So whether it be immunizations for the kids, doctor office visits that are your annual exams for adults, for kids, flu shots, all sorts of things are covered at 100%. And in the Anthem booklet that you'll get, it has a whole, I think it's like 3 pages listing all of the preventive care services that are covered at 100%. And when we say 100%, it means that if you have a deductible, you don't have to pay the deductible first. If you have a copayment on your plan, there's no copayment. So literally, you walk in, get this preventive service, walk out, and not have any copays at all. Your plan does come with a part of the wellness package has a vision exam. That has a $15 copayment if you go in the network, or $30. You get a $30 allowance if you go out of the network. So the way that we'll read through this is on the left, all of the benefits are listed, and then in the middle column, you've got your Key Care 30 plan and how that works, and then all the way to the right is the high deductible health plan. In your booklet, these are laid out a little bit differently, but sometimes they're a little bit easier to view, so you may want to look in your little benefit guide at this point. Both of these plans are built on a PPO Key Care platform. Both of them do not require referrals, and both of them work on a calendar year deductible, meaning your deductible starts on Jan 1 and ends on December 31st. And so even though your plan design might be changing on 12/1, if you switch your plans, you may change on 12/1. It will reset back to the deductible amount that you selected on 1/1 of 2016. The Key Care plan has a $1,000 individual deductible and a $2,000 deductible for family. Your max out of pocket is $5,000 and $10,000. So if the wheels fell off your health and you had a really bad significant year, you had a heart issue or a transplant or cancer treatment or any of those kind of things that could run up hundreds of thousands of dollars, the most that you would be required to pay in any one year would be $5,000 per individual. Preventive care, again, at 100%. You have a physician's office copayment, which is $30, and you'll see on this chart it all says PCP. You're not required to select a primary care physician, but any physician that is admitting services that are rendering services that are of primary nature, colds, flus, diagnostic stuff, is $30. If you go to a specialist and have any kind of specialist services, it's $50. Urgent care is the same. If you're seeing a primary care physician or you're getting primary care services in an urgent care, it would be $30. If you're getting specialty treatment, it would be $50. So if you went to an urgent care clinic and went for a flu or an ear infection or something like that, it'd be $30. But if you're going for stitches or a broken arm or some sort of testing on your heart or whatever, it could be a $50 copayment for those things. Everything from there on in is deductible and coinsurance. So ER, inpatient, outpatient, labs, advanced labs, all of that, you have to meet your deductible of $1,000 first. Then the insurance kicks in and pays 70%, and you pay 30%. And then once you meet your $5,000, the insurance company will pay 100% after that. Your pharmacy services are a 4-tier. This is a little bit different for you. It's on a 4-tier drug. So it's a $10 copayment for generic, $30 for tier 2, $50 for tier 3, and then you'll pay 20% up to $200 per prescription on anything that's a specialty drug or self-administered, injectables, those kind of things. There is a mail-order prescription drug program, and that will give you its 3-month supply for a lessened amount of money. You do have a non-network benefit, and you'll see that your deductibles and coinsurance is higher at a network. Your Luminos high deductible health plan has a $3,000 calendar year deductible for an individual and $6,000 for a family. Your individual out-of-pocket is $4,000, and it's $8,000 for a family. So again, if the wheels fell off on your health, this plan only has a $4,000 out-of-pocket as opposed to a $5,000. Your preventive care is covered at 100%. What's significant about this high deductible health plan is your out-of-pocket is less. You really have a $3,000 medical out-of-pocket, because if you notice, once you hit your $3,000 individual deductible, everything is covered at 100% except for prescriptions. So really what happens is if you go to the doctor, if you get a pharmacy, if you go in the hospital, anything that you do on this plan goes straight to your $3,000 deductible. So you don't have any co-payments. You really don't get any benefit. It's more of a catastrophic type care. But once you hit your $3,000 individual deductible, everything's covered at 100% except your drugs. Your drugs then revert to this 10, 30, 50, the same as they do on the other plan co-payment. So when you start looking at this plan, please make sure you're understanding that this has a lower out-of-pocket. So if you knew you were going to have a surgery or you knew that you were going to have a baby or something like that, this would probably be a better plan, especially like having a baby, because you typically wouldn't go from $3,000 individual to a $4,000 out-of-pocket, because having a baby doesn't require a lot of medications. So you'd probably be hit that $3,000 individual deductible and be done. Whereas if you were actually on the Key Care 30 plan, you'd have a $1,000 deductible, then you'd pay 30% of the cost. You'd probably hit your individual out-of-pocket at $5,000. So it could cost you $2,000 more to have a baby under the Key Care plan than it would under the Luminous plan. So just something to think about. This plan also has a non-network benefit. What's interesting about the non-network benefit that works a little bit differently is if you have a $5,000 annual deductible, but it combines with your $3,000 deductible, where in the other plans they're separate and individual deductibles. These combine together. So that high deductible health plan gives you the benefits of an HSA. You can only open an HSA if you actually have that high deductible health plan. And what an HSA actually does for you is gives you an opportunity to put money away in a bank account that belongs to you on a tax-free basis in order to pay some of those medical expenses. So knowing that you have a $3,000 deductible, knowing that you may go to the doctor once or twice a year for a flu or a cold, you may have to have some blood work done, you may have a baby, whatever it is, you know that you have a $3,000 deductible. So you could literally put $3,000 in a bank account and not pay tax on it, do it on a pre-tax basis, and then pay for that medical expense and never pay any money for that, any taxes for that on that $3,000. You can put it in this account and you can let it build up, or you could put it in this account and you could spend it on medical expenses. If you open an HSA account, you'll get a debit card and a checkbook, and so it's really just a bank account. And so what's really nice is, so you have tax deductible contributions, tax-free dollars end up paying for medical expenses, but what's great about these accounts is that they belong to you, the employee. Regardless of where you work, regardless of anything, this bank account, once you establish it, belongs to you. It's just a bank account. And so it doesn't have that use it or lose it provision. You own the dollars that go in it, and once that money is in, it's yours forever. You don't ever lose it. So if you were to put it in and 6 months later decide that you want to leave the organization and go work somewhere else, or you get fired, it doesn't matter. That bank account is still yours. All the money that's in it belongs to you. And so when you move to a new job, you can actually use that money on out-of-pocket expenses on your new plan. You can't put any more in it unless you, in your new job, you get a high deductible health plan. If you don't spend any money out of that account, you can continue to save it, and all that money would accrue toward a retirement, and you could take it out at retirement. There are some rules about who can participate in an HSA because it is an IRS-governed account. You have to be on a high deductible health plan to put money in it. You can't be covered on anybody else's health plan, including your spouse. So you can't be on a high deductible here and then have your spouse cover you on his or her health plan as well. You can't be covered on a flexible spending account of your own or your spouse's, and you can't enroll in Medicare, TRICARE, or Veterans coverage. So there are some limitations on really where you can be insured. And the deal is this, is you can't double dip. So you can't put money away in an HSA and then having somebody else pay your claims. All your claims will be adjudicated through the Anthem Health Network of Key Care. So if you're going onto Anthem's website to look for a doctor or a physician or a hospital, make sure that you're looking under Key Care, because it will ask you what network you're looking for, and you all are on the Key Care network. Your dental plan is actually staying the same but changing to a new carrier, and it also has some little bonus type of coverage on it. The dental plan is a PPO through Guardian, and you'll get Guardian coverage effective 12/1. Guardian does not send out cards, so physicians can look you up using your social, or you can pull down a card based on off their website. You have an annual maximum benefit of $1,000, which means the most that you can get from the insurance carrier in 1 year is $1,000. Unlike your health insurance, where the maximum is what you pay, this maximum is what they're willing to pay. Your annual deductible is $50 per person, or 3 times in a family, or $150. So each person will have their own $1,000 and their own $50 deductible. But all your preventive services are covered at 100%. So your cleanings, your x-rays, your fluorides, panoramic x-rays, your oral exam every year, all of that is covered at 100%. You get 2 cleanings per year. They have to be 6 months apart, but they're covered at 100%, and they are not subject to the $50 deductible. If you decide to go out of the network, that benefit is not 100%, but 80%. Basic services are fillings, extractions, oral surgery, face maintenance for kids. All those kind of things are covered at 80% after your $50 deductible. And then if you go out of the network, they're covered at 60%. Major services are crowns, bridge work, periodontal work, endodontic work. All of that is covered at major at 50% after the deductible. And then there is no orthodontic coverage on this plan. One of the benefits of this plan is that you have a rollover provision called the Oral Health Rewards Program. Basically, your claims are administered from January 1st to December 31st. You get that $1,000. And if for whatever reason you get 2 cleanings and a oral health exam and x-rays, and you don't need any other dental work in the whole entire year, you're not going to spend that $1,000. So this gives you an opportunity. If you have to at least get your cleanings and your oral exam and all that, and that would satisfy that would spend about $500 of the $1,000 maximum. Once you do that, any remaining money left over, $250 of it will carry over in the first year, or $350 if you use an in-network benefit, an in-network doctor, and then it'll accumulate towards your max rollover. So what will happen is you literally over time can have $1,000 of your regular maximum claims in a year, plus $1,000 of maximum rollover. And if you think about it, most people don't really spend every year big dental dollars. Once in a while you'll have a filling or a crown or something that has to go in. That doesn't usually happen every single year. So most years you'll find that you'll get your cleanings, you'll get your maintenance stuff done, but then after that you don't spend any of their money. Well, this company gives you an opportunity to save that and then use it when you really need it. With that, the Guardian dental rates are actually lower. So here are the rates, which are also in your booklet and on your enrollment sheet. We're also moving the life and disability to Guardian. So the life insurance is effective again 12/1, and the life insurance, everybody gets it. Everybody who's a full-time employee who's eligible for benefits automatically gets this. You don't necessarily need to enroll in it. You'll get it. You get 1 time your salary up to $50,000. So if you have a $40,000 salary, you'll get $40,000. If you have an $80,000 salary, you'll get $50,000 because it maxes at $50,000. AFP pays 100% of the premium, so again, you don't need to enroll. This includes an accidental death and dismemberment benefit, which means that if you, in essence, it means that if you died in an accident, you would double your benefit. So if you had a $50,000 death benefit, then if you died in an accident, you get the $50,000 plus an additional $50,000, or 1 time your salary at the max. In addition to that, there's a will preparation service that's included. So for those of you who need assistance in preparing a will or haven't done so, there's specialists that will help you to prepare that will. Benefits are reduced beginning at age 65. So as you become 65, there's a declining scale of benefits. also have the opportunity to buy life insurance. So if the 1 times your salary is not enough life insurance and you don't have any other life insurance, there's really not a cheaper way to buy additional life insurance. So that AFP has allowed you to buy additional life insurance. It's available to all employees and their dependents. You could only purchase life insurance on your dependents if you elect it on yourself. So you can't buy it for your spouse or your children unless you buy it for yourself. You can elect in increments of $10,000 all the way up to $500,000 or 5 times your salary, but you can't do less than $10,000. If you elect voluntary life for yourself, you can then elect it on your spouse and your children. And if you'd like to buy it on your spouse, when you look at the rate sheet, you'll see that there isn't a separate rate for your spouse. It's for your spouse's age. It's based on yours. So you look up your age, and then they'll give you the corresponding rate for your spouse. It makes the assumption that your spouse is the same age. Even if your spouse is not, you'll still get that rate. The maximum benefit that you could buy is $500,000 for an employee and $250,000 for a spouse. It's all guarantee issue up to $100,000 for you, the employee. So if, regardless of your health history, if you're sick, if you've got cancer, if you've got really bad diabetes, no matter what you have, you'll get a guarantee issue policy up to $100,000 if you apply for this. So anywhere between $10,000 and $100,000 that you select now, you'll get guaranteed. If you decide not to take this now and wait, for a year or 2 or whatever, if you do not elect it now, you'll be subject to medical underwriting, meaning you can't wait 6 months or a year and then decide you want to buy it. If you decide in 6 months and a year or a year that you want to buy it, you can buy it, but you have to fill out a medical form saying that you're eligible to buy it. And again, this benefit will also begin to gradually decrease at age 65. You're also offered disability insurance. We have 2 kinds of disability insurance. You have short-term disability, which is voluntary. You can buy it if you'd like to, or long-term disability that's offered by the organization. For the short-term disability, all full-time employees are eligible. You can buy it in increments of $100, but the minimum is $200. And basically what you're buying is coverage to cover your income. So should you become ill with an accident or an injury or a illness, you actually can insure your income for 13 weeks. So if you think about it, if you don't buy the insurance and something happens to you where you get in an accident that isn't workman's comp, or you get sick, you find out that you have to have a big surgery, or you have cancer and you have to go through treatment, can you pay your bills for the first 6 months of an illness without having somebody help you? And so this insurance would help you. So after you're out for 7 days, 7 sick days, on the 8th day of your disability or illness, this would kick in and pay up to 60% of your income. Now, if you look at the premium on it and 60% of your income is more than you can afford to buy, you can buy anywhere between $200 a week all the way up to $1,500 a week, whatever fits your budget. You are offered long-term disability, and that comes to you automatically. AFP pays the premium for you. This is a great benefit that we don't see many people offering to their employees anymore. So should you become disabled, you've got to figure out the first 13 weeks or 90 days, and then after that, this disability policy that's being paid for your employee, for you by your employer, will cover 60% of your income, your monthly income, until you're eligible for Social Security, whether that be 65, age 67, or if you're granted Social Security disability early, this policy will pay until then. If you've granted Social Security disability and it's less than 60% of your pre-disability income, this will make up the difference for you until you turn a normal Social Security retirement age. The maximum monthly benefit on this is $3,500, and again, this is given to you by the employer. So that concludes the discussion around the benefits that are offered to you. All of those are available to review and read in your employee guide that you have in front of you. Digital is a company that offers service to not just the employer and the management team at the group, but also all the employees of AFP. So the phone numbers are here. You can call direct or toll free. It brings you into our office here in Richmond, and we have customer service folks that are willing to help you with all issues surrounding claims, or if you lost your card, or if someone's having a baby, or you went to the pharmacy and they didn't, the copay was really a weird amount of money and you don't know what happened. Any of those things that happen, we're here to help you to get through those issues. So please make sure that you give us a call if you need our help with anything. What you need to do now is complete the election form. So whether you want coverage or not, you have to complete the form and let us know who you're insuring and what you're selecting. You do not need to fill out a medical form, with the exception of those who are coming on for the first time or making a change to who you're insuring. But if you're going to insure yourself on the same plan that you had last year with the same dependents, you do not need to fill out any medical forms. However, everybody who works for AFP needs to complete an application for all the Guardian plans. So those Guardian plans, there's an enrollment packet there, and you need to complete that for all the levels of coverage. If you do not complete that, you won't get the life insurance or the disability that's given to you. So you need to complete that. And please make sure to designate a beneficiary. All your election forms must be completed and into HR by Wednesday, November 11th. Thank you, and this concludes the open enrollment for AFP 2016. Thank you.